Okay, thanks everybody for joining in this month to our educational webinar. As you saw in our emails, we're talking about growing horse nutrition this week, so healthy beginnings. We do these webinars monthly. They're an educational opportunity. At the end, I really hope that everybody asks questions. Oops. So we'll talk about in utero feeding, because really that's one of the most important times to start feeding that foal. That's when we have so much flexibility going on. A lot of the groundwork, the foundation for that foal is already being developed then. Then we'll talk about feeding the foal once it's been born. Basics about bone growth, because when we talk about foal growth and feeding growing horses, we often go into, well, disorders, developmental, orthopedic disease, that kind of thing. And so in order to understand those disorders better, I think it's important to have a bit of a basic understanding of how bones are actually supposed to grow. So early gestation, less than 6 months of age, early embryonic loss. Some of the things that we have to be concerned about are environmental factors and feed, because early embryonic loss, especially in that first 30 to 60 days, is a really important factor. On the right-hand side, you can see what's actually developing. So day 9, we've just got our embryonic vesicle. By day 24, though, we start to see the tail nub, some blood vessels, a little eye bump is on that embryo, some limb buds. And then by around day 40, we've already got some joint features being developed, eyelids, as well as ears. So the heart is also developed by day 24. Anyone who has bred horses or been around when the vet comes out to check and says, yep, there's a heartbeat, that's very early on, at least by about day 24. So I always maintain that it's really important to make sure that critical vitamins and minerals are being supplied to the horse very early on, because we have these critical organs like the heart being developed and already starting those limbs. So the old adage of when's the best time to feed the growing foal, and people say, well, the 3rd trimester, if we broke pregnancy down into three sections, is really wrong, because as we go through, you'll see the only things that are occurring in the final trimester are laying down a lot of tissue and fat. So the critical foundation to the foal has already started at 24 days. So we really need to make sure that we have that mare on an ideal plane of nutrition prior to her ever going to the breeding shed. But then at least once she gets pregnant, she needs to be on a good plane of nutrition. Continuing on with that early gestation, so around day 50 to day 55, you can see we start to develop ribs, brain casing, some of the brain features. By 2 months, we've got hoof development. 2.5 months, male, female, muzzle hair and eyelashes. So, the B vitamins that are critical for hair quality are important. 5 months, again, we've got mane and tail being developed. Then if we move on to that mid-gestation, around 7 to 8 months, taking into account that the mare's pregnancy is 11 months, energy and protein requirements start to increase. They're really not increased or elevated in that first trimester. Mineral requirements are important, but protein and energy, we don't need to increase that in that first trimester. But now we do, because we start to see actual fetal growth. So the size of that fetus starts to develop around 3 ounces a day. Vitamins and minerals become even more crucial for fetal development, and they start to increase in their requirement. The liver, the heart, the kidney, the brain, the lung, the bones, all are being developed in this mid-gestational period, and so it's extremely critical that iron, selenium, copper, zinc, magnesium, these minerals are being supplied in adequate amounts to the mare. Feeding hay alone is not going to cut it. Even if the mare is fat and you say, well, she looks really fat, we know that there's typically not going to be enough selenium or copper and zinc in that hay, no matter how good quality your hay is. So if we look at the difference between what's the fetal size in early gestation versus mid-gestation, we've got the size of a pea versus the size of a small beagle now in the 7 to 8 months. Late gestation, 9, 10, 11 months, gaining 80% of that false body weight. About a pound of growth a day. Sorry, I kept hearing a noise and I was just making sure everyone was muted. This is also when that dam will start to fortify fetal liver stores. Mare's milk is not high in minerals at the beginning at the beginning of lactation. So we absolutely need to make sure that the mare is getting adequate nutrition during late gestation, because the body's way of dealing with the fact that milk is not high in minerals is that mare will start to fortify or put minerals into the fetal liver so that once it's born, it will actually draw those minerals out of the liver until it's used those up. And by the time it's used those up, it's around the 3-month period. And that's when milk production starts to really drop off and they're starting to eat a lot more food, eat other food. So we also have an increase in energy and protein requirements because we have a large amount of muscle and fat being laid down. Muscle and fat is not the foundation to your horse. Bones, heart, lungs, all those critical organs are the foundation, the structure to your horse. So the beginning and middle part of pregnancy is really, in my mind, the most critical time to make sure that you have got a sound, solid nutritional base. And you have to build on that for late gestation. What other things do we need to think about when we're feeding that in utero foal? The immune function. We all know that foals are born with very limited to no immune function. We want to give them the best start possible. There has been several research studies showing the benefits of feeding chelated minerals, so those organic minerals, instead of what I would call rock-type minerals, to mares during pregnancy, because that benefit gets transferred to the foal, as well as the benefits of feeding technologies like moss, the mannose oligosaccharide. The Alltech version is called biomoss. Its ability to bind bad bacteria and boost immune function, the research has shown that foals are then born with a much higher immune function. Their immunoglobulins are much higher when their dams were fed chelated minerals and moss throughout pregnancy. So it's very critical that these technologies are incorporated in your feeding program for your pregnant mares. These technologies are in the DAC products. So you know what? Why are we talking about all of this? We are feeding future equine athletes. You know, a lot of us love babies, but the end point is a mature horse that is going to be a sound athlete or a sound companion for the owner. Minerals are being deposited in the bone. If we have poor nutrient uptake, i.e. we're not using available sources of nutrients, then we'll have a poor skeleton. Nutrition mistakes are amplified in the young foal. We need to make sure that we want to have the best performance potential possible. So let's look at milk production in that, say, 1,000, 1,100 pound mare in the production curve, and this comes out of the nutrient requirements for horses. You can see in that first month we have a very high milk production, around 35 pounds a day, but then it really starts to drop off in the second and third month. We really see a decrease in milk production. Let's talk about bone in young horses. At birth, horses have only 17% of their mature bone mineral content. Whoever's got their phone ringing,
Ja.
you could.
Ja, ich bin am die Tania på här gången väl.
We can hear that. So by 60 days of age, a horse should grow to at least 75% of its mature wither height. Now, there are ingredients that we have in our DAF products that also improve wither height. Most lower limb growth is complete before the yearling phase. By 18 months of age, the average thoroughbred will have reached about 90% of its mature height. Now, thoroughbreds, standardbreds, these breeds typically mature faster than something like a draft or warm blood breed. So that mature height may be closer to 24 months for their mature height, or even longer. I wanted to point out another technology that we utilize called live cell yeast. The brand that we use is from Alltech. It's called Yeast 1026. And there have been research studies when feeding pregnant mares yeast sac at the recommended feeding rate, what that does to the wither height of foals. Now these are in centimeters because all science is in metric. So over the age in horses along the bottom axis and wither height on the left axis, the orange line is the wither height. So you can see at the beginning there's definitely a difference, but it's not significant. When we get around to about a month of age or slightly over that, 42 days of age, and onwards is when we really start to see a significant difference in the wither height of these foals. Body weight is the same, and at 10 weeks of age and at 17 weeks of age, they measured body weight of foals from dams that were fed live cell yeast and that were not, and the foals then also went on to be supplemented. You can see a significant difference in body weight in the 10-week-old and 17-week-old foals compared to no yeast. So I think that's very important. Why is it that the yeast is having this effect? It improves fiber digestion. The most nutrients that horses get comes out of the hay. So if we can unlock the fiber and make them get more nutrition out of the hay, then we can see a lot more improvement. It will boost the amount of energy that's available to put into that foal, greater milk production, better performance. This is the big one, higher phosphorus and calcium availability, which is directly related to bone strength and the lower incidence of DOD. We recommend feeding the Orange Superior throughout pregnancy to the mares. Obviously, with most feeding programs, we also recommend feeding DDA to any horse. So for a pregnant mare, Orange Superior and DDA are the foundation with good quality forage to her feeding program. As you get into the latter parts of pregnancy, if she was on a straight grass hay in the beginning parts of pregnancy, towards the end, to supply more energy and more protein, you definitely want to add alfalfa hay to the diet. We will go on to talk about protein and how protein is not responsible for growth disorders in foals. So don't be concerned about adding alfalfa to your pregnant mares. Let's talk a little bit about bone growth, because as I said, it's important to have a bit of an understanding of bone growth so that you can see how it may break down and we get these developmental orthopedic disorders. So in the fetus, what we're seeing, osteoblasts. What are osteoblasts? Think of them as bone cells. They're little cells that create bone. They're living in the cartilage deposits in the spongy bone. So here in the middle, at the very beginning, you know, in that when we first saw those limb buds in the first trimester and into the second trimester at the beginning, it's just cartilage. We've got this, what looks like bone, but it's all cartilage. Then in the middle, we start, bone grows from the middle out. And so we start to see this bone cells be deposited and start to spread. And you can see in the bottom, it's spreading even further, and it's moving out towards the ends of the bone. Late fetus to foal. Those osteoblasts now, those bone cells are colonizing in the ends of the bone. We're going to then start to see these growth plates. The marrow in the middle starts to develop, and on the very ends, we see hyaline cartilage develop, which protects the ends of the long bones. The growth plates remain here. So in a mature horse, the marrow is extending the length of the whole bone. We've got cartilage on the ends of the bone, but you see the growth plate has been converted to bone. There is no growth plate anymore. This is just a picture of bone. So as the bone increases in length, it's called endochondral ossification. It occurs at that growth plate. It involves calcification of the cartilage in the growth plate, followed by the replacement of this cartilage with bone. In a normal situation, new cartilage is formed at the same rate at which cartilage is replaced by bone. So that is what happens in normal growth. New cartilage replaces at the same rate as which cartilage is replaced by bone. So we'll look at this diagram here. It's animated, hopefully. And we want to grow lengthwise. We've got our growth plates here. We'll see growth plates close up and all the cartilage is replaced by bone. Depending on the bone, this will occur at different rates. So developmental orthopedic disease is an umbrella term. We are going to only talk about osteochondrosis and fasciitis today. It also does include angular limb deformity, wobbly joints, that kind of thing. But we'll talk about these two in particular. But it occurs when there's some kind of breakdown in the endochondral ossification that we just talked about. So that turnover from cartilage to bone, something's breaking down and it's not occurring correctly. So let's talk about osteochondrosis first. It's a failure of the normal endochondral ossification. The calcification of that cartilage did not fully take place. Some cartilage is retained and not replaced by bone. Subsequent stress breaks down the cartilage and causes a flap to separate, which we would then call osteochondrosis dissecans, or OCD. Or the retained cartilage undergoes necrosis, and then we get these fluid-filled pockets, which causes a bone cyst, and it also decreases the strength of that bone. Other things that can occur, they can affect the cartilage in the articular surface or in the growth plate, so on the end or in the growth plate. Most common site for OCDs is in the stifle or the hock. Most common site for a bone cyst, where the cartilage just didn't turn into bone, is in the femur or the fetlock joint. So you can see here osteochondrosis in the articular cartilage on the end of the joint right here. And if it breaks away, you'll have that flap or floating around in the joint. Now if we get this part of the bone not turning into, this part here of cartilage not turning into bone, that's where we get those cysts. This is what it looks like actually in the joint when that cartilage breaks off.
On trigger engine. Yeah, hang on.
Fasciitis results from the failure of normal endochondral ossification. Cartilage production outpaces the conversion of cartilage to bone. So unlike the osteochondrosis, the cartilage is not retained. It results in an enlargement of the growth plate and sometimes pain and lameness. So this again in a little animation. You can see the swelling here. This is the growth plate, and you can see the swelling occurring here. 2 common time frames for fasciitis to develop. 4 to 8 months of age. We'll see it a lot in a fetlock. In the fetlock, gives that hourglass appearance. 10 to 18 months of age, it's often what we refer to as that open knee. So the causes of developmental orthopedic disease, any of the ones that we've talked about, and the ones that we didn't talk about, there is a huge genetic predisposition. I have people tell me, well, I've bred the same mare to the same stallion 3 times in a row, and I keep getting developmental orthopedic disease. What's wrong with my nutrition? Well, maybe you're doing everything perfect with your nutrition, but it's a genetic predisposition. Could be trauma to the growth plate or articular cartilage, a hard fall, an injury, poor or inadequate hoof trimming, irregular exercise, irregular or rapid growth. Now this irregular exercise could be the mare has had a colic episode, for example, and maybe had to go and have surgery, and so the foal, who hasn't been weaned yet because it's young, is stuck in a stall on stall rest with the dam. And there's nothing wrong with the foal, but it's now getting very limited exercise. Irregular or rapid growth. We see this a lot, especially when we take foals that perhaps didn't have the best nutrition in utero, then somebody purchases them, doesn't know their backstory, feeds them, adequate nutrition and even perhaps too many calories, and they have these rapid growth spurts. So we really want to keep the growth curve very uniform. What we can control also is the diet, imbalanced diet. So I just want to touch on some of those technologies that we talked about earlier with the mare in the young growing foal. So yeast sac that we talked about earlier, there was also another study done looking at feeding yeast sac to these mares and foals and what it did to bone strength, what it did to the availability of calcium. So if the yellow line on the bottom here, this is only 80% of the required amount of calcium given to the foal. No yeast, just 80% of the required amount of calcium. And you can see that the bone strength is significantly lower as we progress, as they're really starting to lay down more bone. If we do 80% of the calcium requirement plus we add yeast, and then in the green line we look at 100% the requirement for calcium, those lines are very similar. I would say that they're not significantly different, the red and the green line, which says to me, if you feed yeast to the dam who's lactating and to the foal, you can get the same response in bone strength as if you were just feeding 100% calcium. So adding yeast to the diet can overcome some insufficiencies in a diet. But then the pink line, which is where we want to be, is 100% of the amount of calcium being supplied to the horse and adding that live cell yeast. And you can see bone strength is significantly higher at all points of growth. So that rapid rate of growth or uneven growth rate, fast then slow then fast. Some people will say, you've got to slow down their growth. Unless the horse is dead, they're really not going to slow down their potential. What we want to do is make sure that the growth curve is even. See this nice even growth curve. There's no dropping down here, going higher here. It's a very even, smooth growth curve. We need to make sure that we're feeding adequate amount of energy with adequate amounts of protein, minerals, and vitamins. So what happens when we feed diets that are, say, high in sugars and starches, high in energy, but don't supply adequate protein and vitamins and minerals, for example, a grass, hay, oat diet with nothing else added, we're going to be supplying adequate energy, most likely from the oats, but there is nowhere near the adequate protein if it's just grass, hay, or the minerals and vitamins. So we absolutely need to make sure that when we're supplying adequate energy, we have to meet that with protein and minerals and vitamins. Excess protein is not a problem. Low calcium is a problem. I showed you a graph earlier saying yeast can help unlock calcium. So high phosphorus, it can interfere with the calcium absorption. Let's make sure that we're feeding quality sources of calcium and feeding ingredients that can unlock calcium. Deficiencies in copper, zinc, and manganese as well. We want to make sure that we have ideal ratios of calcium and phosphorus. 2 to 1, 3 to 1 even of calcium to phosphorus. Never have more phosphorus than calcium. The digestive feed additive is not a supplement that we're highlighting in this month's advertising, but the DDA, when feeding it to the mare and the foal is then getting milk from the mare and those benefits are coming through to that foal, is also a part of growing horse nutrition's diet. So once you start to add supplemental nutrition to the foal, which can be as early as 30 days of age, depending on your program and your awareness of whether there may be a genetic predisposition, as well as the CMZ paste for those therapeutic short-term doses. For a base diet, I would have colt grow and the digestive feed additive, the DDA. So I'll finish there and take any questions that you have. Let me see if people have asked any questions. Feel free to type questions. Okay, Everett asked the question, how long does it take for mare's milk to become rich with supplementation? What mare's milk supplies is energy and protein, really. It really doesn't. It supplies some calcium, but as far as those minerals, the mare's milk is really not the source of mineral and nutrition. It's the fetal liver and then whatever the foal starts to eat on its own. So mare's milk is not an adequate source. It's never been designed to be an adequate source of vitamins and minerals. The enlargement of the fetlock joints in weanlings is not OCD. No, OCD is when a flap will actually break off in the cartilage, and really to be able to, if it's just swelling and we get an x-ray and there's nothing going on, there's no flap that's broken off, then it's just fasciitis, or it could be osteochondrosis if we see some kind of bone cyst there or irregularity in the cartilage, but it doesn't become osteochondrosis dissecans until the flap of cartilage actually snaps off. Feel free to unmute yourself and ask a question now if we don't have any other questions that have been typed into the chat box. Okay, I'm going to stop the recording